could you introduce yourself and give me some of your background just a little bit?
Sure. My name is Molly. I am a registered nurse. I got my bachelor's degree at Calvin University in Grand Rapids, Michigan, and I have been a nurse for about 3 years now. When I first graduated, it was in the middle of the pandemic. It was 2020, so it was a little difficult to find a job at first
Right.
because a lot of places didn't want to hire new grads. So I was able to finally find a job at this big community hospital in a city nearby.
Mm-hmm.
And I worked there for 6 months. It was on an ortho neuro unit where we did mostly post-op surgeries and ortho stuff primarily. But I was on the night shift and I worked pretty much full time there for only 6 months because shortly after I started, the nurses, we were a union and they all went on strike.
I see.
And as a new person at the hospital, I
Yeah.
kind of had to go on strike. I didn't really have many choices.
Right.
So it was almost a good thing, a blessing in disguise, if you
Mhm.
will, because I hated my job and I was miserable going into work every day.
Yeah.
It was stressful and
Yeah.
busy, and I just did not like it. So the strike was kind of a good thing because it gave me the opportunity to look elsewhere for work without feeling like I'd only been somewhere for 6 months, and it's not always a good look to jump ship so quickly. So I spent the next 3 months looking, and I was able to get a job at a veterans hospital in
Okay.
another nearby city.
Yeah.
And that was actually where I had originally wanted to work.
Uh-huh.
But normally, for at least the VAs around here, you have to have at least about 2 years experience before you can even apply. However, since it was the pandemic and they really were short on staff, they were hiring temporary nurses and they didn't care how much experience you had. So I knew a couple people who worked there, and
Yeah.
they gave my resume to the hiring manager, and I got right in. And I have been there ever since. I got a permanent job there. I work on the COVID step-down unit.
What does that
which-
mean? Sorry to interrupt, but what is
No,
it?
that's okay. So COVID, obviously, it means we get all the COVID admissions. They come to us. They don't go to any other unit. And that kind of waxes and wanes depending on what's going on in the world, I guess.
Yeah.
Right now, our numbers have been pretty low, and we're a small unit to begin with. We're actually max at 12 patients. And then the step-down portion is that we get step-down patients. You're getting vital signs, you're checking their blood pressures and all that more frequently. So every 2 hours, they're on these step-down monitors, but they're not sick enough to be in the ICU, intensive care unit. So it's kind of like an in-between where they need higher level of monitoring and maybe more interventions, but they're not as critical as the ICU.
So, Molly, what is the best and worst part of the job?
Oh gosh. I think for me, the best part of the job, obviously the obvious answer is getting to help people, getting to help patients, and feeling like you're making an impact on their life. But that aside, my favorite part of nursing
Yeah.
is learning and connecting all the pieces. And I think obviously you're never done learning and you're always expanding your knowledge.
Yep.
But I love when it all starts to make sense to me, and that happened probably a year or two ago,
Yeah.
probably 2 years ago,
Yeah.
when things started to click, and I was like, okay, I get my rhythm, and I feel like people might look at me and think I know what I'm doing, and I kind of feel like I'm there.
Yeah.
But even still, just like I love being able to read through patients' charts and finding out all their history when I have time, of course, seeing their history and their presenting symptoms and their past issues, and kind of connecting it all together with what's going on currently, why they're in the hospital. And it's just really fun for me to learn new things. I'm more on the knowledge side. I like the knowledge. I don't like the skills as much. I don't like learning new. I mean, it's whatever, learning new skills, but I'm always more interested in the medical part of it and
Right.
The textbooky stuff.
Yeah, like kind of putting the pieces of the puzzle together, right?
Yes,
Okay. Sounds good.
And then the worst part
Yeah,
of my
worst
job,
part. Yeah, what is the worst part?
the worst part is being stressed and feeling like your patient's gonna crash.
Uh,
At least for me,
Yeah.
especially since on our unit that doesn't happen a whole lot, where somebody like totally goes south and maybe codes.
Yeah.
But when it's your patient going down, circling the drain, that's really stressful.
yeah.
And yeah, I don't know. I mean, you do it and then you get through it and you kind of think, wow, I learned, I knew what I was doing,
Right.
surprisingly. I
Yeah.
always I didn't know I knew what I was doing. But yeah, when you're in it, it's definitely stressful because A, the liability, and B, obviously you don't want to think that you missed anything or that it's ever comes back on you, and you want the patient to have a good outcome.
Right.
So, the other thing I would say is just like the faith aspect, where you're there doing God's work, and I always think of my shifts as like, if I can touch one person, then I've done my job.
Yeah.
So kind of like just being there for them emotionally, while obviously being the best nurse that you can be, and making sure that you're being thorough and not letting anything slip through the cracks, where you did your part, and then whatever happens, happens, and that's kind of life. So that might sound morbid,
Yeah.
but as a nurse, you can't get too attached in a way that you don't expect the patient to,
Yeah.
I don't know.
No,
That makes sense.
No, that's not. So Molly, we're walking in the neighborhood you grew up, correct?
Yes.
Yeah. So since we're walking, can you walk us through what your shift looks like? The moment you go in, the moment you come out.
Okay, sure. I'll
Yeah.
try to keep it brief.
Okay.
So I either work 8-hour or 12-hour shifts.
Yeah.
So I'm coming in at 7:30 p.m. or 11:30 p.m.
Okay.
Work until 8 a.m.
Yeah.
Right away, we come in. The assignment sheet is made, so you know what patients you're getting. I like to write my report out on a blank sheet of paper.
Yeah.
Everyone does it differently. Some people have more organized ones, but I like to organize it as I'm writing it,
Yeah.
and I do it the same way every time. So you sit down and you get a report from the nurses who are leaving for the day. So let's say I have 4 patients. I might get 2 patients from one nurse, 2 from another nurse. It just depends, whatever.
Yep.
So I write down and kind of an overview of why the patient's there, review of systems, so that you know what the assessment has been of the patient, like a physical assessment on
Yep.
like lung sounds, bowel sounds, heart sounds, skin, all that. You spend about a half hour getting your report,
Yep.
writing it all out. And then it depends. If I come in at 7:30, we have 10 o'clock meds usually for
Yeah.
most patients.
Yeah.
You start giving meds at 9, an hour before. So I have a little more time when I come in at 7:30, where I can like maybe peek my head into the patient's rooms, make sure they're breathing.
Yeah. If they're alive.
because that would not be on me.
Right.
And okay, they're good. And then I sit down at my computer and I start looking up their charts.
Okay.
So that's when you're kind of digging in deeper to details on the patient. You're looking at doctor's notes. So let's say cardiology has seen them, they're writing their own notes. So you're also reviewing that note.
Okay.
And then I would start really doing my true rounds on my patients, where I go and get everyone's meds, put them on my little cart, computer with wheels.
Yeah.
We call them cows.
Yeah.
Computer on wheels. And then you're doing a quick head to toe assessment, listening to hearts, lungs, bowels. So after that, then you made all your rounds, everyone's good, you sit down and you start charting. We have a lot of charting to do.
Yeah.
I'm sure anyone who's a medical
Nurse.
professional who's watching this video knows that there's just loads of charting. I'll add no shortness of breath, no respiratory distress, pulse ox within normal limits in the respiratory section, and then the cardiac, I always say no chest pain or cardiac complaints.
Okay.
That's kind of my standard.
Yeah.
Then do a skin note and a plan of care note.
Okay.
And then you're pretty much just watching the patients throughout the rest of the night. They're hopefully sleeping.
Yep.
And you're just making sure they're alive and stable. And if their vitals are, making sure their vitals are done when they need to be. In the morning, we'll give meds, usually starting at like 5 o'clock, depending. Some people will have antibiotics due in the middle of the night, so just hang in those. And then if something comes up, a patient has something concerning or anything like that, you're paging the night float doctor who's covers overnight, and you're writing your note about that. I talked to Dr. So-and-so, and this is what he said, this is what I did, blah, 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 blah.
Yeah.
In the morning, you give report at 7:30, the next shift comes on, and you hand off your patients to them, and you go home.
Well, how do you stay alive though throughout the whole night? How do you keep stay awake?
It's a good question.
Yeah.
Coffee.
Just
I drink coffee.
Yeah.
And I don't know. Sometimes if you're on with the right people, then you just do fun things. You hang out and you play pranks on each other.
Yeah.
And yeah, sometimes the patients keep you really busy though, and you don't have a minute to sit down. So it all depends.
Okay. What is the craziest patient interaction / story you have?
Okay. So I'm gonna preface this by saying crazy things happen at almost every shift.
Yeah.